Hello, everyone, and welcome to our webinar today on Shaping the Future of Healthcare, Middle East Path to Value-Based Care with a Data-Driven Approach. Today, we have panelists joining us from three companies that have been at the forefront of this transformation: Innovaccer, Snowflake, and Pure Health. I am Neela. I'm a Senior Director of Product at Innovaccer, and I'll be moderating the session today. So before I invite our panelists to introduce themselves, let me give a brief introduction of the three companies that you see represented here. Innovaccer is the data platform that accelerates digital transformation and innovation for healthcare systems. We have been an integral part of the value-based care journey in the US with our 70 plus customers, and have now brought our solutions to the Middle East region to enable a digitally led model of care for healthcare service providers, insurers, and public sector organizations. We are backed by Mubadala Investment Company, and we have a partnership with ADIO, the Abu Dhabi Investment Office, to improve the accessibility, affordability, and quality of healthcare in the Middle East. With ADIO support, Innovaccer has also established a research and development hub and a commercial function as part of its Abu Dhabi headquarters. The next company is Snowflake. Snowflake's platform is the engine that powers and provides access to the data cloud, creating a solution for data warehousing, data lakes, data engineering, data science, data application, everything you can think of in relation to data. The data cloud is a global network where thousands of organizations mobilize data with near unlimited scale, concurrency, and performance. Inside the data cloud, organizations unite their siloed data, easily discover and securely share governed data, and execute diverse analytic workloads. Finally, we have Pure Health. Pure Health is the largest integrated healthcare network in the Middle East, with a cross-category ecosystem that covers more than 25 hospitals, more than 100 clinics, a network of 160 diagnostic labs, the UAE's largest insurance company, pharmacies, health tech, procurement, and more. So with that background, let me give you the context for the conversation today. In our session today, we will be talking about how value-based healthcare is transforming the landscape in the Middle East and how a data-driven approach can help you accelerate this shift towards value-based care. So without further ado, let me introduce our panelists. So just to recap on myself, I am Neela. I'm a Senior Director of Product at Innovaccer. At Innovaccer, I lead the CRM suite of products. Prior to Innovaccer, I had a career in management consulting, spending several years with McKinsey & Company, mostly in the US. Let me now hand over to Rizwan.
Hi, everyone. My name is Rizwan Tufel. I am the Chief Data Officer for Pure Health. Neela was kind enough to talk about Pure Health and what it does. A little bit about myself. I spent about 30 years in the technology and management space. Did my own startup in the San Francisco Bay Area many years back. Spent about 10 years with Microsoft at the headquarters, and then also leading their Africa work. I'll hand over to Mohammed.
Thank you, Rizwan. Good afternoon. My name is Mohammed Koda. I'm a sales director in Snowflake in the Middle East, Turkey, and Africa region. I've been with Snowflake for almost 2 years now, but I've been in the region for over 15 years, helping organizations in the healthcare environment across the region as they embark on their journey to digital transformation and better patient care. I also happen to have a healthcare background, so that's a bit of a soft spot for me. I'm a physiotherapist by profession and worked in Australia for a number of years before moving to the UAE. Akhtar, over you.
Thanks, Mohammed. Hello, everyone. This is Akhtar Mubaraki. I lead delivery and business for Innovaccer in the Middle East. Before this, I was leading the customer success and implementation in US for almost 10 years and have kind of been responsible for implementing the value-based care and the population health models of healthcare for the hospital group CINs and ACO in US for last 10 years.
Thank you so much. Thank you so much, Akhtar. Thanks everybody for this introduction. Let me now spend just a minute on the agenda and also lay down a few rules of how this session is going to proceed. And then we can get started with this very engaging discussion. So our agenda today is to first lay the groundwork on understanding what we mean by value-based care. And then we discuss some of the benefits as well as challenges in the transformation to value-based care models. We then move on to the value-based care ecosystem, specifically focusing on a roadmap for an organization's transformation into value-based care. We then spend some time on the technological aspects, speaking of both artificial intelligence as an enabler for value-based care and also the overall ecosystem of technology being an enabler for value-based care. Finally, we will conclude with a customer success story, after which we will have 10 minutes dedicated to question and answers. And then we will have a short poll for the audience to participate in that will be used for our report that we will be sharing shortly. All right, so let me also lay down a few rules about how the session is going to proceed. This is a 60-minute webinar, so that includes the Q&A that I mentioned. If you have any questions while the discussion is taking place, please feel free to add the question and the speaker that you want to address that question in the Q&A box. And if you have any questions post this session, you can also write to us at team.me@innovaccer.com. We will share this email ID with you at the end of the session. All right, so without further ado, let's get started with this very exciting conversation. So value-based care is, it's a very hot topic, and one hears mention of these three words all the time from every member of the healthcare ecosystem. But it does beg the question, is there a commonly understood interpretation of what value-based healthcare actually means and also how to achieve it? So maybe we should start there by defining what, according to this group, is value-based care. So MK, let's start with you first. Okay. Akhtar, maybe let's move on to you.
Sure. So I think there was some issue on MK side
Yeah,
regarding his audio. Can you know?
Sorry, I had a mic issue, so apologies for that.
Perfect. MK, go ahead, please. Feel free. Go ahead, please.
So as I was just saying, in addition to a lot of the items that's on the list there, I think when I think about value-based care, I'm always thinking about human-centric. I think that's really key at the crux of delivering service to the patient. And that really touches on being personalized and driving more personalized care and being very flexible. So let's bring the clinical healthcare service close as you can to the patients, whether it's through virtual or telehealth, that we're seeing a big boom in that, or actually starting to think about other models like home-based care models, in addition to the clinical settings. And I think a lot of the organizations are adopting this, and we're seeing more and more transformation to that area. But I think it cannot be done without collaboration. And when you look at collaboration, we're talking about the patient, the payer, the provider, and how does technology help to enable that. And I think a lot of the organizations are really grappling and trying to mature to be able to deliver on that promise. Over to you, Akhtar.
Thanks, MK. And I totally agree with each and every point that you have mentioned, kind of slightly taking to a different tangent when we talk about value-based care. I'll talk about the financial aspect of it more. Uh, the name itself kind of defines that, hey, people will be incentivized, organization will be incentivized on the quality of care rather than the quantity of care. And that has been one of the, I will say, tectonic shift that value-based care had brought into picture. If we go earlier, like 10, 12 years back, from the traditional model standpoint, it was always the reimbursements, the incentives were always aligned in terms of like, hey, how many appointments are happening from the quantity standpoint. But what value-based care did is it brought the perspective of quality of care, that hey, we can have n number of appointments with our physicians, but is that actually helping us to take better care of our patients? And that's where it's bringing the value into picture, where or incentivize are aligned in terms of quality of care and less on the quantity of the care. And that is why it has been kind of a talk of the town, where every organization wants to move to a model where people want to focus on providing better healthcare, accessibility of the care is there, while as focusing less on the quantity. And overall, it has helped to kind of bring the cost of the care down, because now everybody is focused on the quality, everybody's goals is aligned. Rizwan, I'll pass on the floor to you in case you want to add your comments to this.
Sure. Thanks, Akhtar. So I'll add just a couple of thoughts on this. So we're talking about value-based care. We've got to think about who we're creating value for. The other thing is, I think language is very important. And when we generally talk about value-based care, we think of three parties or three concepts. We think of the patient, we think of the provider, we think of the payer. But let's also be honest that these words actually have meanings only when a person steps into a clinical setting. When I step into a clinic or a hospital, that's when I'm a patient. That's when I'm interacting with a provider. That's when I have to think about whether my payer will reimburse or not. And I think that there is actually an opportunity to go one step further back. And that's what we're focused on. So we've been thinking about value-based care in its entire totality of a person's journey. The idea being, the more we could help people not even step into a clinical setting, the more we are actually adding value to them and to their health. So how can we help them with prevention? And when we think of prevention, suddenly the conversation changes about awareness building, about education, about engagement, and helping people take better care of themselves. So that is the angle that I think we should always keep in mind when we're thinking about value-based care. At some point, I'm more than happy to share about information about a number of pilots, a number of initiatives that we are taking right now in that particular preventative area. Back to you, Neela.
Thank you so much for all of your insights on how you define value-based care. And I think the consensus that I'm hearing are the following words, right? Value delivered to a person's health, quality achieved with collaboration, right? And I'm sure we're going to talk about all of these aspects as we continue the conversation. So that is a very natural segue into the benefits of value-based care. So let me start with Akhtar. Akhtar, you have been a part of this journey in the US for a long time now. And you have seen the transformation, right, of health systems into value-based care models. Can you start us off with the benefits of value-based care that you have observed?
Sure. Thanks, Neela. I'll be glad to do that. And I want to start with the point that Rizwan was kind of bringing in the previous conversation, that there are three broader pillars of when we talk about value-based care, and that's patient, provider, and payer. And when we take these three pillars together, we form the overall society or the ecosystem of the value-based care. And I want to start with the patient itself, because patient is at the center of the care. All the enablement, all the technology, all the processes and policies that we are bringing into picture, the central focus is basically like, hey, how can we improve healthcare of a patient. So from the patient perspective, the most important value addition that I see, I can kind of use two terms for that. One is accessibility and second one is affordability. And what I mean by that is accessibility, that hey, what value-based care has enabled is basically care is available to everyone. And affordability means like, hey, it is accessible at a cost that people can afford. Because every country has the different policies of healthcare, and mostly in the Western world, the cost of healthcare is so high that there is a good margin of people who are not able to afford it, or who are rather not able to afford it pre-value based care came into picture. And that has one of the, I will say, top edge that value based care brought into picture, that care is available to everyone, and it is available at an affordable cost. When I talk about the second segment of it, which is basically the provider, the most important aspect that comes to my mind is satisfaction. Are providers, are patients both satisfied with the care that is being provided to them? And value-based care has enabled that. There have been multiple levers for that. What value-based care has enabled is basically increased patient engagement. There is more interaction happening with the patients, and what the tendency is to prevent patients from going to hospitals. Preventive care has got a bigger notion in value-based care. We tend to prevent patients from going to the hospitals, and which saves the overall cost. And the second thing is it has brought operational efficiency in the system. Organizations are collaborating together. There is more efficacy, there is more efficiency in the system, because everybody is kind of focusing on a common goal. Point how it has enabled is basically the overall cost of care has reduced, it's more cost efficient, and at the same point of time, there is a reduced risk. Earlier, everybody was going to the clinic, there was central aspect that, hey, yeah, we are coming to the doctor, we are getting appointments, we're getting taken care of, care is being provided. But what value-based care has enabled it, like, hey, patients have different clinical conditions, and for each clinical condition, we need to have a slightly different aspect, so that we kind of treat them properly, which has overall helped to kind of reduce the risk associated with the patient. Intent being, can we kind of prevent patients from going towards high risk? If we have patients in the low risk bucket, can we kind of prevent them from going into medium risk bucket? And if we have patients in medium risk bucket, can we prevent them from going into the high risk bucket? So if I combine these three pillars together and see what has been the overall, I will say, value addition or the benefit that value-based care VBC has brought into picture, there is better care for everyone, and there is self-awareness. Patients now know that, hey, what they need to do so that they remain healthy over a period of time, they don't fall sick. And second aspect that I have already touched based on a bit is care is available to everyone at a reduced cost. People can afford healthcare now because they don't have to spend a lot of money in terms of going to hospitals again and again, because there is an aspect to it that, hey, we are focusing on quality of care and not on the quantity of the care. So those are the kind of the broad aspects that I see in terms of value-based care, the benefits of the value-based care.
Thank you so much, Akhtar. Since Snowflake has been helping organizations transform their services across the globe, what, in your experience, are the key benefits that you have witnessed?
Yeah, thank you, Neela. I think Akhtar touched on very important topics there. When we look at whether it's cost, whether it's looking better patient outcome services, the clinics. If you think about all this, it's really still pointing towards a holistic patient 360 view. And I think that's one of the beneficial outcomes of value-based care. And how do we support that? Now, if you think about delivering this, this requires data coming in from multiple different sources, and you can see all the 4 areas there. And this, at heart, is a data challenge. So if we can keep the patient data flowing all the way through to the point of care, so that clinicians can make better decisions and actually deliver better outcomes. An example of that, and I think most of us who go out into the hospital settings here in the region, we typically go to the hospital, you see the doctor says, look, I need you to go and have an x-ray. You go back to the front desk, they submit the request to your insurance provider, and then you wait for an approval, and that takes a couple of days. Now imagine if we can actually get that data flowing seamlessly, and the amount of time we can cut to be able to get those approvals coming through ASAP. On the other spectrum, there's a lot of patients today are using smart devices, whether it's wearables, whether it's in-home diabetics kits. So imagine if we can actually take that data and feed that into their data, a consolidated data platform that clinicians can actually read that data ahead of seeing the patient. So these are really important things. I think the other thing that's really important is making sure that we are keeping and maintaining data governance and data confidentiality and accuracy of that data.
Thank you so much, MK. Rizwan, the UAE and the overall Middle East region is undertaking a lot of steps in the direction of value-based care. One of the key initiatives being the Ejada pilot. Can you speak to some of the benefits that you have observed?
Absolutely. Thank you. And this is a great opportunity to sort of talk about the value-based care model in the Middle East, but also take a step back. I think always context is very important, and in the UAE, at least where we operate, the bulk of our facilities, you've got to understand the context or the realities on the ground a little more. In a situation where 10% of the population is local and 90% of the population is expats and therefore highly transient in nature, the shape of value-based care also needs to take into account that reality. So for 90% of the population, what is the engagement model for them? Why would a healthcare system and how should a healthcare system engage with them, knowing that they will be in this particular environment for a couple of years and then will leave and move somewhere else? We also know that value-based care is a journey. It isn't something that you do over a short period of time. Those are the nuances that make value-based care really, really interesting. And I think it strengthens, again, the earlier point around empowering the individual so that the individual is better placed to take care of themselves. We know that value-based care is a population-wide concept and it manifests its benefit the most at that scale, but decision-making and action needs to happen at an individual level. What I'm excited about the most is the opportunity for the Middle East to write the playbook on how patient engagement and value-based care should look like in the context of highly transient populations.
Rizwan, in your description of the benefits just now, you did also touch upon some things that seem to me to be some of the challenges on the transformation to value-based care, right? So you, of course, spoke about a very specific challenge in the Middle East with its transient population, but also in a more general sense, continuing on that train of thought, what are some of these challenges that healthcare systems are encountering in their journey towards value-based care?
That's a great question. So I think that the first reality is that the healthcare ecosystem in the Middle East, maybe more than many other geographies, is very, very ununiform. It is very heterogeneous. And what that means is that there are large hospitals that are really, really mature in their systems and their approach to data, etc. And then there are also hospitals that I would say are still on that journey. So if we are to move towards value-based care, the very first step is actually ensuring the trustworthiness and reliability of data. As of now, healthcare organizations are at varying levels, not only in their technical maturity, but also in terms of their use and the accuracy of data. There is still a lot of work happening and work that needs to happen in that direction of data quality, maturity, and interoperability. We also know that hospitals use different coding systems, use different vocabulary to capture the same symptoms. So that creates a huge challenge and the need for uniformity, because once we have that, that is when we will be able to see the system-wide data availability that Mohammed, for example, refers to as a patient walks into a clinical setting, to be able to have the data around that patient, but know exactly what that means and know what that means in the coding system, for example, that the hospital at that point in time is using.
No, thank you so much. I mean, those are some very, insightful comments on the challenges. MK, I'd love to hear from you as well, some of these challenges that you may also have encountered.
Yeah, thank you. I think I just want to add one point to Rizwan's comments. I think when we saw the COVID-19 pandemic came through, we actually saw the differences between organizations who are mature and ready, who are cloud ready, who are taking on board and being agile to the responses. So that was one particular part. And now what we're seeing is a greater drive of cloud adoption across the healthcare system. And we're also seeing a lot more around data collaboration, data exchange. Obviously, Pure Health has been part of that and spearheading the HIE systems. But that's one angle. The other part is when I think about it from a patient perspective, patients today, as we move more and more into digital and AI, actually expecting more. The expectations from patients is much greater. And I'm not sure whether or not yet our providers are actually up to the task, up there. They're definitely working very hard to get to that level. But when I talk about consumerization of care, if you think about it, 60% of patients globally, when surveyed, said that they would like to be able to, or they expect that they could change their appointments, they can make appointments, they can check their medical records, they can check their test results, or even order medications online without having to visit the clinic. And so that change in expectation obviously puts more pressure on the providers to really step up. And I think that's really happening. I think that's really a good start. But to do that, you still need to have a single point of truth of that data and to be able to deliver on that. And I think that's where the regional players and the hospitals like Pure Health is really doing a great job doing that. The other one that I want to touch on, we speak a lot around technology, and that's a great entry point. But if you're thinking about driving change and you want agents of change, we need to start thinking about involving the clinicians, the physicians, the people who are actually delivering the business. And I think they're the ones that we need to bring in on board to deliver that change across the organization. So that's the other point, that I think we typically jump into the technology too quick sometimes and forget about the business itself.
Absolutely, absolutely. It's all about enabling that ecosystem, which is not just technology alone. And that, I think, is also a very, very good segue into kind of our next discussion, which is going to focus on what does that roadmap look like of this transformation journey across the ecosystem, right? We talked about the people, the policymakers, the healthcare providers and payers, and that robust data foundation that is really tying all of these together. One almost thinks of it as a step-by-step roadmap, right, for an organization's journey that touches all of these different levers. So let me then invite Akhtar to speak on this topic.
Thanks, Neela. I think you raised an important point that we have to consider this whole as an ecosystem, because there are so many players involved, and what we need to understand is like, hey, how all the players kind of combine hands to drive this ecosystem towards good. And when we talk about overall, like, this has been kind of the traditional roadmap that we have been following in all over value-based care and PHM implementation in the last 10 years. The core remains with data, because one of the challenges that we have also previously noted is like, hey, there are no data-driven decisions happening, and data is a core of everything. We need systems that can kind of marry clinical claims, labs, and other data sources together and help us to kind of reach to decisions which are data-driven, help us to kind of generate insights which kind of shape the roadmap for the value-based care. So data management is very critical for the overall roadmap of value-based care. Once the data management is done, the second important step is opportunity identification. What are the top levers that we need to start with? Because for an organization who wants to kind of implement value-based care, there are 20, 30 aspects that they start with, but are all of them equally important? Which ones are more priority over other? So it's very important to kind of identify those opportunities, identify the levers, which kind of drive better outcomes and which kind of drive positive outcomes. And data is going to be an enabler for that. So data management and opportunity identification is very important. The third step, risk stratification, and I touched base in one of the earlier discussions as well, that is very critical because different patients have different needs. There is a general, I will say, an 80-20 analogy in healthcare that, hey, 80% of the cost goes in kind of taking care of 20% of the patients, while as the remaining 80% of the patients only consume 20% of the cost. So that's very critical. We need to understand that, hey, who are the patients that we need to focus on? Not only identify the patients that we need to focus on, we need to also identify that, hey, what is that we need to focus on these patients? And that's what kind of like defines the operational workflow. How do we engage with these patients? Once we have these patients identified, we need to define multiple workflows, be it, let's say, like there could be disease management, there can be preventive care, there can be any other elements. So identifying the risky patients and then building operational workflows for those patients is very critical. And the last important point of this is kind of optimization. Once we kind of enable this value-based care roadmap for an organization, is it successful? What are the iterations that we need to do over the course of time to make it robust, to make it more optimized? So that is the last element. We have to consider this as a whole journey. It's time taking. It's time consuming. I haven't seen an organization who will say that, hey, in 6 months time frame, our value-based journey is done and we have implemented it. No, there is always an iterative process. There is always a scope of improvement. So it always starts with data. We do stratification, we enable the workflows, and then we optimize on top of that. That has been the general market trend for all the organizations who have been successful in terms of like implementing value-based care within the org, or kind of supporting other organizations in terms of implementing value-based care. This has been kind of, I will say, the secret sauce that has helped them to kind of be successful. It always starts with data. It always ends in terms of optimizing more and kind of going towards the version 2. Hey, can we have the version 2 next year, which will be even more robust, which will be even more patient-centric? So that has been the general roadmap of the value-based care.
You know, when you were talking about the aspects of the roadmap, like starting with data and then stratifying the risk and, optimizing the outcomes, it really kind of lends itself to the buzzword of our times, right? AI. And so I think the next natural question is, how can AI be leveraged for enabling these objectives? Would love to start with you, MK, for your point of view on this.
Yeah, thank you, Nila. So obviously we're all hearing about AI, we're hearing about generative AI, we're hearing about OpenAI. So it's quite a buzz. But I think there is definitely a big opportunity to leverage AI to help in many different areas in value-based care. If you think about some of the areas that could potentially help in appointment settings, going through the appointments and using the machine learning to actually recommend maybe people don't all need to come into the hospital. Maybe you can do some of those appointments remotely. If we look at the data that's coming through from various different devices, wearables, internal, can we look at some clinical predictions through AI to actually deliver better clinical outcomes? The other one that I think that's important, and I think most people are starting with, is non-clinical workflows. So how do we automate those non-clinical workflows? Start with those administrative mundane tasks. And I spoke about one of them earlier on about facilitating the automation between a provider to the payer and making sure that the approvals comes in much quicker. But that takes away a lot of that burden away from the provider themselves, so they can actually focus on the patient. One thought that I think is quite interesting, and this one alluded to preventative value-based care and prevention. But if our hospital systems locally have a wealth of data, clinical data, They have access to a lot of data externally as well. So if we can create, a generative AI platform where they can go in a vetted environment and not just going to Google and doing searches and doing their own administered help, but if people can go in there and put a couple of details, and they can get prescribed accurate preventative activities to actually improve their health longevity. That's one aspect. But also maybe in the future we could be doing self-service treatments, in a very controlled and safe manner. So I think AI can play a very, very interesting role today and going into the future.
Building on this emphasis on automating the non-clinical workflows, Rizwan would love to hear your thoughts on, the opportunity for using AI models for non-clinical data, and how would that journey from non-clinical to clinical look like?
So I completely, thank you, Nila. I think I completely agree with MK around prioritizing non-clinical applications and only then beginning to think about clinical. And there are multiple reasons for that. Number one, we've already spoken about the maturity of data. And I think that, or at least in our case, we see that the non-clinical data you can actually get much more help in terms of ensuring that the quality of that data is reliable, et cetera, et cetera. And only then, as you build confidence as an organization, begin to think about clinical applications. The other element that MK also alluded to is, at the end of the day, we're dealing with real people. We're dealing with, we're asking clinicians to trust the data and what the data tells them. And to do that, we first of all need to make sure that we build confidence through other use cases where they can see this in action, they can build a little bit of confidence, and then bring that into their workflows. My father was an orthopedic surgeon, and I think that he would have been the very first one to say, when I bring in something new, I need to absolutely make sure that it serves my patients better. And we need to build that level of confidence. The last thing on this is, and I think the AI thinkers on this call would appreciate that as we begin to experiment with AI models, explainability to the layman or to the average person is really, really important. So there's this recommendation. Well, why is that coming through? And as we work with data, as we build confidence on the non-clinical side, hopefully that builds the organizational capacity and willingness to engage and begin to use the data and the analyses.
And Nila, I totally agree with what MK and Rizwan have mentioned over here, and seeing organizations who are kind of trying to bring technology into picture to improve the overall healthcare. One of the issues that we have seen is there is always provider burnout. When I mean provider burnout, it's burnout both at the care coordinator side as well as the physician side. And I think it's almost every country I see a report where they say, hey, we are lacking X number of physicians. The patient to provider ratio is highly skewed across almost every country. And same goes for the care coordinator to the patient ratio as well. And I think that's where AI can be a revolutionary step, because there are two aspects of providing care. One is the back-end office, where you kind of call the patient, bring into clinic, schedule appointments with them and whatnot. And the second part is the front end, where actual care is kind of being enabled for patients. And I think back-end part is something that can be truly revolutionized by AI. A lot of effort that goes into kind of scheduling those appointments and doing all that back-end operational day-to-day work for a patient, that can be fully automated by virtue of AI. What that will enable is, one, make the overall system more efficient, and second, it will reduce the burnout of physicians and providers, so they have flexibility of time to focus more on the real aspect of healthcare, which is kind of talking to the patient, making sure patients are feeling healthy and improving their healthcare. So AI in that aspect is going to be a revolutionary step in terms of the overall healthcare domain.
Thank you so much. I know we went, on a conversation around AI, but really kind of taking a step back, looking at the entire technology stack that can enable this journey. So the question then is, what is that, end-to-end kind of technology that enables the value-based care journey? And Akhtar, I'd love to start with you.
Sure. I think this is a very important system because we have been using the word ecosystem multiple times during this conversation. And we need to understand healthcare cannot be driven by a single organization or a single entity. All there are like so many players who are involved in terms of like making healthcare accessible to everyone and providing better care to everyone. That includes clinics, hospitals, data aggregators, policymakers, an organization like Innovator, Snowflake, Pure Health, like all of us combined together have to kind of club hands to improve healthcare and make it better. And what I want to focus on, there are two broader elements to it. Like one, that we need to act as levers to for that enablement, because there are so many players that we need to bring together and enable outcomes on top of that. And that's what we want to present over here, is basically like an organization like Snowflake and Innovator can kind of combine hands, where we bring all these players together. We kind of provide them with the technology, we kind of do provide them all those enablement and levers that help to drive the outcome. That outcome could be purely clinical in nature in terms of clinical transformation. That outcome can be financial driven in terms of providing better care to patients at an affordable price, or that could also be in terms of the operational efficiency or the operational transformation that we have been focusing via AI. So intent is basically like, hey, organization like Innovator and Snowflake, we need to combine hands, we need to kind of join hands and make sure that, hey, we are bringing all these players together. We're kind of aggregating them to kind of act as an enabler so that the overall outcome is there. We're focusing on a final outcome, which is kind of, hey, provide better care to patients at an affordable price. That is kind of how we see organization like Innovator and Snowflake coming together, joining hands and enabling all other organizations to kind of club hands together and move towards one goal, which is like, hey, better and affordable care for everyone. MK, definitely would love your thoughts on this one, so feel free.
Yeah, thanks, Akhtar. I think I echo your message. It definitely needs to start with the business and what the business is trying to achieve. I think without that, applying technology for the sake of technology doesn't serve the purpose. I think you need to understand where you're going in your journey, where you want to be, to make sure that you're actually putting the right the technical capabilities there. And Snowflake obviously playing a very key role in the data platform space, but it also, you need to think about the ecosystem of that to be successful. So having a data platform, but you need to be able to run the workloads on top of that. You need to integrate with many other technology ecosystem players, whether it's machine learning, AI, visualization engines, but also you need to have some of the domain experts helping you out. Pure obviously being a domain expert in that space, coming in and giving their view on things. Then be able to aggregate, if you look at the bottom, getting that data from the various different sources, and then qualify that data, clean that data, and make sure that the data is providing the outcome that we want, which is around patient experience and value-based care. So definitely something important to consider.
Yeah. MK, continuing on that thread, can you maybe bring this to life with an example of a transformation story from a customer?
Yeah, sure. So we'll just go to the next one. So Prisma Health is a healthcare provider, a large healthcare provider in the US. They've got over 5,200 clinicians, 18 hospitals, many beds, etc. And it started from the business discussion, as I was saying earlier on. So what they wanted to really focus on is driving reduction of cost and enhancing preventative care. So two things that I think we've been talking about today was one, alluding a lot to the preventative side of things. And if you understand the healthcare system in the US, costs are just spiraling. And what Prisma Health want to do is take a bit more of social responsibility, not only cutting costs for themselves, but cutting costs to the patient themselves and going back to delivering value-based care. So they did that by establishing and driving better relationships between the employee, the insurance companies, the ecosystem. Now, to be able to do that, you need to then bring that data together. And they had a lot of disparate data all over the place. And they, in order to be able to understand where they can reduce costs and what preventative care programs they can run, you need to be able to have the data in place. So we helped them along that journey with the support of Innovaccer, working very closely together. Not only did we put the platform that allowed them to actually visualize and make that those decisions faster and cheaper, but I think more importantly, what we helped them to do is to look at programs and use cases that are really going to make that difference, such as, driving targeted vaccination programs in a much more efficient and quick manner. We're now working with them to actually aggregate data from various different sources like environmental, weather, even their consumer patterns, so that we can really sit down and put together some preventative plans for them. So that's what we did with Prisma Health. We're doing very similar things with a lot of entities in the region here, helping them along that journey.
Thank you so much, Ankit. It's so amazing to see the impact of this work, right? I mean, especially for something as critical as COVID-19 vaccination program. So thanks a lot to all the panelists for sharing, their perspectives, their very valuable views on the benefits and challenges to value-based care, and then also helping us with the roadmap for that transformation, and then bringing it to life with examples. We have some time now for addressing some of the questions that have come up. So why don't we spend the next 10 minutes in looking through and addressing some of these questions that the audience members have. So the first one, this one is for you, Rizwan. Can you share best practices for building a solid data infrastructure that will support the measurement of patient outcomes and quality metrics in value-based care initiatives?
That's a big question, and I think that it obviously. So I can give you some perspectives from our network. So as I said, we operate a large network of a number of hospital facilities. It would be interesting, or maybe people would think that where one would need to start off is thinking about the technology. In fact, where we had to start off, or where the organizations that are part of Pure Health started off, by actually spending a lot of time up front in defining the KPIs, the quality KPIs that they want to measure, agreeing on how those KPIs would be measured, so that there is consistency across the entire organization around what each data point actually means. And it seems like a very simple exercise, but it isn't. It was an enormous amount of effort. And maybe I'll also just take this opportunity to bring the conversation back to one of the points that was made earlier around ecosystem and leadership. I think on that one, I would just like to say one of the reasons why we are excited about the acceleration that we're seeing towards this vision of value-based care is because of the very solid leadership that we see from the regulator in Abu Dhabi. In Abu Dhabi, the regulator has taken a very, very active role in defining the quality KPIs. They've actually taken a very forward-looking view on how data needs to be collected, trying to make sure that some level of data can be shared with the entire ecosystem, so that we can actually drive changes and improvements across the entire system, and we can raise all boats. Hopefully I've answered the question.
Yes, thank you so much, Rizwan. The next question that I have is for Akhtar. So Akhtar, we have a question here. that talks about strategies for healthcare institutions to adopt to overcome interoperability challenges and create a unified health data ecosystem. What are your thoughts on that?
I think, Neela, I will answer that from two aspects. One is from the policy aspect, and that's, I think Rizwan was also trying to focus on the previous one, that, hey, from the policy standpoint, we need to understand how important is it to bring interoperability within the systems. So that has to be there from the policy and the strategy standpoint. The second aspect of it is from the technology standpoint. I think the biggest barrier that I have seen till now is a common system which acts as a unified data model. What I mean by unified data model is something which can marry data from multiple sources together, be it clinical, be it claims, be it EHR, because what has happened in the market over the last 15, 20 years is like multiple systems have been built to kind of solve a problem or to kind of resolve a problem. But what we haven't considered broadly is basically like, hey, how do these systems interact together? There has to be a layer on top of that, because we can't go back to all the EMR systems in the market and tell them, oh, start writing everything from the scratch in a uniform code. That's not possible. We can't do that same with the claim houses who are clearing claims and tell them, oh, let's have a uniform code across adopted everywhere. That is realistically not possible, because nobody is going to change so many systems in the market. So the need of over there is a unified data model and a system that can manage all these data sources together without huge investment. The uplift in terms of data management that has to be done by that system. Let's say if we have a system in place that's capable of ingesting data from claims, that's capable of ingesting data from labs, that's capable of ingesting data from EHR systems, merge that data together and then give insights for organization. So they don't need to invest in 4 different systems again, which are not talking to each other basically. So that is kind of a need of an hour. 2 elements I will again repeat. There is a policy side of it where everybody needs to think that, hey, how these systems communicate and how can we adopt a uniform language. For the systems that are already in place, there needs to be a unified model, a layer on top of the system, which helps them to kind of talk to each other, which kind of understands language from all these individual or siloed systems and converts that language into one, so that language is kind of adopted by every organization in the market. That's need of all to kind of resolve this problem.
Thank you so much. I have one more here, which talks about, are we following the same value-based care transition path as the US? Or are we expecting a change in policy and implementation mechanism in the Middle East?
Perhaps if this question is for me, sure. I will say definitely there needs to be a change. Sorry, go ahead.
Oh, please go ahead. Sorry, there's a lag at my end. I apologize.
Sure. Now, I will say there is definitely a need for change, because every market is different. Every market has different dynamics. The policies that have been adopted in US are suiting a particular population. I don't think we can kind of have that off-the-shelf solution and fit that in Middle East. The policies need to be slightly tweaked, because like both Rizwan and MK kind of alluded the point that the population in Middle East is different. We have a huge number of expats who don't kind of stay in the region for the longer run. So I don't think the US model can be readily adopted over there. There needs to be certain change at the policy level as well as at the technology level that kind of suits the population in Middle East. And I don't think it's only between like even having 10 years of experience in the US over there also, that there are variations in the policies that have been made. The variations that focus on the rural area are not same as how healthcare is kind of being provided in the urban areas. They have understood it over a period of time that, hey, there can't be one bill that kind of fits everyone. So considering the same aspect, definitely there will be some policy change, and that have to be considered both on the strategy as well as on the fundamental of the technology that need to be adopted, so that like we kind of make the system much more coherent in Middle East. And it's also about learning from the previous mistakes, the issues that we have faced in the US healthcare. We need to kind of take learnings from those and make sure that, hey, we are not kind of repeating the same issues in the Middle East as well.
Neela, I'll just take 20 seconds and just add a couple of things. I think that the role model would most certainly not be, or even the starting point wouldn't be the US. Maybe even a closer starting point, maybe Ontario or one of the provinces in Canada, where I've had some experience with the healthcare system, because there you actually have a central paying system. Remember that in our countries, for the local population, it is actually the government that steps forward and takes that responsibility. Finally, I think that our systems are a little more centralized, with a very active involvement from the regulator across the region. So the peculiarities of the market are very, very different.
Very well said, Rizwan. I think we have time for one last question. MK, I will direct this one to you. How do you measure the efficacy and efficiency of value-based care models?
That's a really good question. I think we really need to determine the KPIs first when we talk about the efficiencies and of the value-based care. I'm not sure if there's a system, and maybe after you can probably step in. You're probably more into that space. But in terms of, from our perspective, from a Snowflake perspective, the efficiencies that we can drive around data and bringing that data into a central place, looking at deduplication of that data so that we have a single point of truth. These are going to help drive efficiencies so that we're not having duplication. The other thing I look at in terms of efficiencies, for example, if you look at today here, the interoperability or the collaboration that happens between insurance companies and providers. I mean, I can easily go in for treatment in one hospital and then move to another hospital and then request the same medical treatment, and you start seeing duplication of cost. So if we're sharing that data, if I've done a CT scan somewhere, it's only been a month old, why do I need to do it again? So that's where data sharing and data collaboration will really help in that data efficiency perspective.
No, totally agree with what MK mentioned on this. Other than the quality aspect of it, like where we have traditional, I'll say, KPIs to measure the outcome in terms of quality measures, I think taking a slightly broader view of this, what we also need to understand is basically like, hey, by implementing a value-based care model, how much patient engagement we have improved. Because it has been always in scope that, hey, the more patient engagement, the better healthcare outcome we're providing. So that has to be like, that could be one of the I will say KPIs that we can utilize to measure the efficacy of an VBC system. And the second one would be manage the risk of the patients over a period of time. If we are able to prevent patients from going to low to medium and high risk buckets, that is the real change. Because if we're able to control the risk of the patients, that means patients are staying healthy. They are not getting scared. Our average population risk is kind of dropping. So that will have an overall impact, be it the cost, be it engagement, be it preventive care, or the traditional, I'll say, quality measures that we're using. That should be like, hey, how do we prevent patients from moving from low risk to medium risk, or from medium risk to high risk buckets? That should be the, I will say, basis of how we are tracking the efficiency of a VBC system.
Thank you, panelists, for your very, very insightful answers. We are almost at the end of our webinar. What we have now is just 3 quick poll questions, and the purpose of this is to include it in the report that we will compile at the end of the webinar and distribute among this group in some time. So let me quickly move on to the poll question. I wonder if there is a bit of a lag on my end, but is everyone able to see the poll question?
Yeah, I can see it. Right?
Okay, perfect. Yeah, so go ahead and choose the question. I'm sorry, choose your answer.
So if we could just get the participants just to click on the answers. Maybe if we just go back to the previous question. You need to be able to click on those answers.
Yeah. Please click on the answers, yeah.
So we'll move to the next question.
All right. All right. So with that, let me thank the audience for being so great and listening to this very engaging discussion among our panelists. Thank you so much. And we will be in touch with you with our reports and summarizing the contents of this discussion. Thank you for being a great audience and have a wonderful rest of your day.
Thank you.
Thanks, everyone.
Thank you.